Hello, everyone, and we are back, right back with this other episode. We're still talking about hospice, and now we're going to kind of dive into hospice and fraud. Ugh, so this has been a hot topic for the last, what, maybe month, would you say, Diane?
I think 6 to 8 weeks.
About 6 days?
It's been discussed on some news channels more than others, the fraud that's coming. And I know people don't like to hear JD Vance is on over on the fraud, but Dr. Oz has really uncovered has uncovered a lot of stuff, and now the investigations are going on, and um, California. For them, it's all about hospice fraud at this point in time. There's going to be other frauds. Anything involved with the government is going to encourage fraud.
Yeah.
But let's talk
Um,
about the hospice fraud in California because
yeah.
it's impacting you guys.
Well, yes, it is. It really is. And I tell you that it's interesting. I know that they just put a moratorium, and I talked about that early on the last
Yep.
episode. We talked about a moratorium that they had put on hospice, and they
Hmm.
also have one on medical equipment companies. So
Yeah.
companies like us now cannot open up a medical equipment company right now because we are in a moratorium. So I think it may be coming to an end. I'm not quite sure, but I know that it was like a 6 months, and I've been so busy, I don't even really know if where we are with that as far as if people
Yeah.
can open up. I know hospice and medical equipment. Now, I don't know if there's some other agencies out there that have been put on moratoriums, but I do surely know about medical equipment companies as well as hospice companies. So today,
Yeah.
you guys, we're going to be talking about California specifically. Of course, there's hospice fraud everywhere. But one of the
Yes.
things, as Diane just mentioned, has been for some reason this thing for California, and that what the data shows. And so, um, and I really, I think that's a disservice to for patients and families, because when you hear people talk about fraud and you see the numbers and you
Yeah.
see people being arrested, it is disturbing, because what it does is it makes families fearful to think like, because I know I would if someone came to me and said like, "Oh, I'm going to put your loved one need to be put on hospice." The first thing I'm going to wonder is, do they really need to be on hospice, or is there something behind this, right?
Yep.
So, let's talk about that, Diane's. California has been in the news for hospice fraud. What is happening here? What are you seeing here? What are you hearing?
Well, one of the things is that made hospice so vulnerable to fraud is because providers are paid a daily rate while a patient is enrolled. Now, decades ago, our government policymakers were told that this was a bad way to go. But our government, for ease of providing services, they thought this was a better way to go, and they ignored all the naysayers who said, no, no, no. So this has really set our whole system up for fraud because a lot of things are paid on a daily basis. But hospice is one that has really hit home, especially in California. And one of the reasons why is because there's really no oversight. There's nobody checking on these people. Every state has supposed to have state auditors, but I don't know if these auditors are getting paid off. The first thing I think of is government employees. They've been paid off. Or are even our policymakers in the states, are they taking funds? It just creates a bunch of mistrust.
Hmm.
The other thing about California is you are taxed to the max on everything for all these entitlement programs. And what's really sad is these tax dollars are going for major lifestyle changes. I will tell you, people are like we started in the first episode, we were talking about like 89 hospices located at one building, office building, and all they were it was an empty building with companies using that address. and billing for fake services. So, and they're using that money for lavish lifestyles, nice homes, nice cars, jewelry, cosmetic surgery. And I think
Mm.
that it's very frustrating. Oh, yeah. So it's not going back to those in need, and it's really negatively impacting um, Californians, and it's negatively impacting anybody where fraud is going. And like you said, medical equipment companies, if you're not dealing with CFS, you shouldn't even be dealing with anybody
Oh my
else.
gosh. Diane, you're fun.
Well, you
Oh my
know what?
gosh.
You go above and beyond for your customers, and that is something that is lacking so much in our culture and society today. And you care and you make sure that people get the right equipment at the right time, and you did because you care. And I love that. And I think that, with all the fraud that's going on out there in so many things,
Yeah.
with hospice or medical equipment, there's more fraud to be learned about in our system, our healthcare system. You have to go to people that are tried and true, and you're involved in your community, and you're very involved with your the people in your community, and that is the old-fashioned way that we really need to go back to.
Well, Donna, for me, I think that well, I'm a patient advocate. So there is a
Yes, you are.
yeah,
That's
so
another thing. Yes.
yeah, so I've always been into taking care of my patients and clients. It's just
Mhm.
it's always been there. So it's not a thing. I don't even the equipment part is like I would say secondary.
Yeah.
Literally, because my whole primary goal is always just to try to see what a person needs and how can we help them, whether what kind of resources they are, right? And so that's the first thing. So I don't even look at it. The medical equipment part of it is like the last part. Like let me tell you, let's figure out what's going on first, right? And then we can talk about the equipment.
Yeah.
Yeah, so and I really feel bad for families because it is so confusing because any of us could be in that situation. Like
Yes.
regardless,
Oh,
you never know
yes.
what happens with us as us. We're prone to be anything can happen to us that we need
Yeah.
to be put on a service or what have you, our family. And it's really scary to think about like you don't know if you're really which company is which. And so my next question is why has hospice fraud become such a concern in California, especially in Southern California, as you talked about earlier? And I'm trying to figure it out. Like what happened here that made it so that's so because we like all these hospices is all over. Like there's so many of them, right? And
Yep.
so
I
I'm
mean,
just
there's tons of them. You have more hospice in California in blocks like 2 or 3 blocks. There may be 10 or 20 hospices located. Just the address, no services or business, just the address. And it's really the problem with California is they dropped the ball. Their state auditor didn't do their job.
Mhm.
And it's very frustrating, and it's sad because it harmed people in ways. Who can trust now that you're going to get what you're supposed to get? And in all honesty, families don't know what they don't know.
True.
And that's why, somebody like me, I'm a fierce advocate, and I'll fire a hospice and say, "You're gone, you're out of here. I want somebody else." And I've been able to do that. But you in California right now have to be so concerned that the next guy may be just as criminal as the last one. You just don't know.
Yeah.
Oh, and then you wonder about what is. But the fraudulent operators are enrolling people who are not terminally ill. Like you were explaining about your friend
Mhm.
that had was an investigator, and said they had somebody trying to sign them up for hospice. And but benefits, what benefits are there? Like that they're not going to get because you don't get your meds paid for. You lose your meds, you don't get your equipment paid for unless the hospice provides it. They're not even sending in good nurses to see you on a regular basis to assess you. You're not getting somebody to come in and provide bathing or personal care assistance. So when they're saying, "Oh, you got to sign up to get these benefits," I don't know what they're talking about. I'm sorry because
Well,
if it's
yeah.
not a, you know, um, uh, California has had enough negative activity in this area. The families really need to verify
Mhm.
who are they dealing with, even if the referral comes from a familiar system. It may come from your insurance company. It may
Huh?
come from your doctor. Um, you know, it sounds to me like there's doctors that have been paid off to refer somebody on hospice as well. There's a lot of stuff going on.
Well, Diane, I'm going to ask you what type of hospice fraud are being reported in California? Because yeah, well, I want to know.
Well, they're actually enrolling people that are not terminally ill. They're enrolling people without informed consent. They're billing for visits that never happened. They're billing for patients who did not receive care. They're using stolen identities or operating these sham companies. In 2026, the California DOJ cases, officials allege that personal identifying information was used to enroll people in Medi-Cal and bill for hospice services that were not legit. So they were stealing identities, actually, and putting people on Medi-Cal and then billing for hospice services that didn't exist.
Wow. Well, we
That just, you know what, that shocks me first because somebody's identity theft is very real and it's
it is.
scary. And the fact that there was no safety net in the California system that didn't pick up on that is very disconcerting to me. Like to you have to fill out of a lot of paperwork to qualify for Medi-Cal. I mean, there's a lot of paperwork and who's providing it and why weren't there red flags within the system that said, hey, there's something not right here.
Well, what's interesting to me when you talk about that, it's interesting you talk about bring that up because I know for us, right, in the medical equipment side, we're surveyed every 3 years.
Yeah.
A server comes in and they look through everything. They look through your book. They
Yes.
take pictures to make sure your building is there. Like, what do you have on the outside
Yes.
of it? Make sure your credentials are up to par. I mean, all these things they do this like every 3 years. Now, mind you,
Yes.
after all the fraud that just happened, we are now going to a once an annual survey, which is very
Yep.
expensive.
Yes.
So now you have the people who, when we were get surveyed every 3 years for national accreditation, they're going
Yep.
to annually now, which is very pricey, and it's going to put a lot of unfortunately companies
Out
out
of
of
business.
business because
Yep.
it's like literally almost $5,000 every time you're surveyed, like between 4,500, depending on what
Oh,
companies you
sure.
use, and some of them are even more than that. That's very expensive. So I don't know what the hospice piece of it is and how their audits.
It will come down to that as well, which is, what's sad is our government created a system that was ripe for fraud, and now they're going to put a system in place that will make the people that are fighting the fraud lots of money instead. It's just, the agencies, the accredited agencies. What's really frustrating is the total lack of auditing. I just don't understand how it can happen because it when you have these companies, you should be expected to be audited on a regular basis.
Mhm.
You should, there's certifications you get when you have a company.
Yeah,
Obviously,
yeah.
it's very easy to to get, and there's nobody checking those certifications.
They're not easy to get, that's for sure. And but you know
Oh,
what's interesting? Yeah, they're not easy to get. But this is the thing too. I don't. It's kind of weird, like because I know because even Silas had mentioned to me. He says the way that you get audited when they come in here, how can any fraud go on? This is what he, you know what I'm saying? Like he's like he sees all this stuff. Like we got a call. Like this is about I think this is the end of like last year. We got a call from one of our CMS surveyors who just kind of come out every once in a while. Calls and
uh-huh.
says, "Hey, I'm gonna be in your area and I'll be stopping by." And I'm like, "Okay, and I'm here." And as soon
Well,
as my
I'm very
documentation,
cynical.
yeah,
After 50 some years in nursing,
yeah,
people get paid off to ignore a lot of things.
yeah, I guess so.
Whether they're
Crazy.
surveyors, and I know people are going to be offended. I don't care. The reality is money talks to some people, and some people have no values or morals when it comes to taking a payoff. Obviously, it's rampant in the hospice field right now, and it could be even could be at a level of our own state representatives are receiving payouts to allow this fraud to occur.
Hmm.
But that's a whole nother ball game. But
Um,
um, our goal right now is to help families in California get qualified hospice,
Yeah, yeah. So basically,
safe
what to
hospice.
ask for, right? How
Yeah.
can a family in California verify whether a hospice is licensed?
Well, there's that you have a system, Cal Health Find,
Oh, what's it
which
called?
is that's run by the California Department of Public Health.
Okay.
And it allows families to search facilities,
Mm-hmm.
check licensing and certification
Mm-hmm.
status,
Mm-hmm.
see ownership, view any complaints, enforcement histories, and to file a complaint.
Oh, so it's called, so you guys out there, it's called Cal, that's C as in Charlie, AL Health Find. That's good to
Yes.
know, Diane. Okay.
The thing that I'm concerned of with this Cal Health Find is
Mm-hmm.
uh, all these facilities have been licensed and they must have had a certification status. So that is a little disconcerting to me, but this is the system that you have in place, and we're going to talk about even more other things that you can do.
Okay.
Um, let's talk about Cal Health Find.
Yeah, let's talk about it. Give us some more information about Cal Health Find. So it says, what is Cal Health Find and how can families use it before choosing a hospice?
Well, like I told you before, you should be provided 3 referrals to
Hmm.
hospices, but
Hmm.
I know that that's probably not happening.
Hmm.
So, Cal Health Find is a California public lookup tool.
Okay.
So, before signing with any hospice, families can search the hospice name, verify that it's licensed,
Hmm.
see whether it accepts Medicare or Medi-Cal or some sort of Medicare Advantage,
Hmm.
because there are in-network and out-of-network hospices under Medicare Advantage, so you have to look
Hmm.
for that, and you have to look for complaints or enforcement actions.
Hmm.
Did somebody file a complaint against them, and did they take action to rectify whatever the complaint was, and make sure that there were systems in place to
Hmm.
avoid that from happening again.
Okay. So no, so this is California, but what about other states too? So I would say that if you are in another state, because fraud is everywhere, and
Yes, yes,
that
yes.
you can probably look on, go on Google or or AI and ask for a Cal something similar to Cal Health Find in your state.
Well, you can always call your state health department
Mm-hmm.
and ask for where you can find hospice companies to make sure that they're legit, and that whatever state you're in should have a system in place
Right.
to provide that service. But always start at your public health department.
And what about your insurance? And what about if you just call your insurance direct, say, hey, how many, what kind of hospice facilities do you have? Because they would have to taking them through credentialing and all that stuff, right?
Correct, correct. Um, and that could be, but what I'm hearing is sometimes these hospices are subcontracted out,
Mm. Yeah.
and because they don't have the staff or whatever. And then you get into issues where the legitimate company may be providing providing services through a subcontractor that's really not it's a bad actor. It's not a legitimate company at all. So there's issues like that you have to be
The
concerned
third
with.
party. So basically, what you're saying is you have a hospital who has
Uh-huh.
subbed out. They don't have an internal hospice company, so they
Right.
sub out to a hospice company. And you're saying that particular hospice company that they have subbed out to may not even be doing the work. It might be they
Yeah.
might be subbing out to another
Yeah.
third
Yeah.
party. So then that's kind of hard to track to see who's who and make sure
It
they
is.
stay
And
on top of it, right?
I was a nurse liaison for a hospice company. And I would go into local hospitals like I was in Philadelphia. So I went to Temple and I went to Hahnemann Hospital, and I would go to the different floors and say, hey, do you have anybody that needs hospice? The goal is for every uh, person that's looking for hospice to be given three providers.
Hmm.
And you should be able to meet them, uh, look them up and check for their Medicare certification, see who their medical director is, what their after hour processes are, and what services will actually be provided. There's things that you can do, and the thing is, I feel bad for families because first of all, they don't know what they don't know. They don't even know what to look for or ask. And so many of them are so tired.
Yeah.
It's just where they're worn out. They just want help. And then now they have to go through all this process. And many of them just don't have the energy to do it. I've seen it a million times because you need to ask questions, and you still have the right to know their license status. I would even look up their medical director. If they have a medical director, I'd look him up in your physician board, your licensing board, to make sure that he hasn't had complaints against him. Because what we're finding is some of these medical directors you have to have a doctor that is willing to say a person needs hospice, whether they need it or not. So some of these companies are, um, have bad actors in physicians that are greedy and don't have any morals or values, that they don't mind getting paid for not doing anything and taking the money and running.
So the hospice agency hires their own doctor, and that doctor is
Correct.
the one who would go and visit the patient to say, "Hey, so
They
and so
rarely go
is on
visit the
hospice."
patient.
Okay, they'll come to the
They
hospital.
well, the medical director of a hospice just looks at the patient's records and says whether they can come or not. He's just overseeing. It's the nurses and the nurse care case manager that'll say, "Hey, we need this. Can you give it to us? Can you provide this medication?" But the medical director rarely ever gets out and sees the patients that
Mm.
are on hospice.
That's interesting you said that too, because I was on a platform a couple of days ago because I'm like trying to find out how all this hospice stuff works, right? And
Mhm.
I was reading some threads, and it literally had nurses on there talking about how they were some of them were working for companies that wanted them to say a patient needed to be on hospice, and they really didn't shouldn't didn't qualify. They didn't feel they were qualified, but they were scared
Yep.
to lose their job because they needed their job. So they wanted them to say a patient needed to be on hospice when that patient really technically did need to be on hospice. And they were
Yes.
saying that they were scared to, they didn't want to do,
And
so
shame on those nurses. Shame on them. You don't need a job that bad that you have to lie and cheat and to keep your job. You can find a job somewhere else. So if you're working for a company run by bad actors, you need to get yourself out of
but
there because
companies do
you're
that.
going to go
So
to jail.
companies do that. Companies literally tell a nurse that you have to meet, they need a certain amount of people on hospice.
Oh, well, you know what? I was responsible for heads on beds.
Oh,
Yes, I had a quota. Now, did I always meet it? No, but you look, people are dying to get into hospice. You'll always find somebody that needs hospice. But it's just and there's a lot of competition, but a nurse should never be asked or should ever be forced to say that a patient's ready for hospice when they're not. That's unethical, it's immoral, and I don't want to be working for that kind of nurse.
wow.
And I don't want to work for that kind of company. I would be giving my resignation and out of there so fast your head would spin.
Wow. So there's a lot of moving pieces.
Yes,
There's a lot of
yes,
moving
yes.
pieces. It,
And I
it
can
seems a
tell you
very
right now,
confusing, like a lot
yeah,
of moving
yes.
pieces.
Well, a bad actor and a medical director is just one piece of it. Yes, if they are out to make money and they're going to do it at the cost of harming others, the people, the patients, and the families, that's that's a whole nother issue. And those people should be prosecuted to the full extent of the law.
Wow. Ooh, you learn something new every day. So if a hospice was arranged through a hospital or a health plan, should families still verify the hospice agency?
100%. You are in a situation where you cannot trust anybody or any company at this point in time. And I feel really bad about that. But the state of California and as well as other states have not been responsible to for making these organizations accountable for providing real and qualified services. And shame on those states because it's caused harm, it's caused great harm to many, and it's just wrong. And we have so I think it's on the family caregiver it's a family caregiver's responsibility to and I know uh, it's hard. You're going through so many emotions and the physical trauma
No.
of providing care for somebody for so long is exhausting. But you have to absolutely step up to the plate and ask questions. And there is no wrong question, not at all.
Yeah.
None. And if you can afford to have a care manager, you can hire somebody, um, me to represent you and ask those questions and do that research.
Wow. And
But
that's good.
there's a lot of people out there that can't. So we're going to talk to you about what you can do. And the first thing they should do is ask, what is the legal business name?
Yeah, that's what I was good. That was the next question. So the next question is, what should families ask when a hospice says we are contracted with for that particular place or hospital,
Yeah,
or we work with your health plan? What happens then? Because honestly, I just want to throw this in there. I think when the insurances created all this stuff and the government, it was more of an honor system. So
yeah,
like for us in our industry, it's like they're hoping that we're honest, right? And when I say honest, I'm saying that if you give me a prescription for a client, a doctor writes a prescription for a patient, and
yes,
you've done the due diligence as a provider of service,
yes,
right? to make
Hmm.
sure that the person is they benefits qualify. You have the proper documentation on file that that
Hmm.
patient can receive that said product, and
Right.
you're doing all the due diligence and making sure everything's there. It's an honor system,
Yeah.
and
Well, as you
so
can see, there's no honor. Yeah. It's not
that's what's so
possible.
sad, and
Yeah.
that's why I was like, man, when I heard all this stuff going on, I was like, oh my God, like because it makes it hard for companies who are trying to do the right thing.
Yeah. Well, there's no accountability. There was no observation. There was no accountability, and that is that's on the state and how poorly it's been run, and it's happening in many different states and different areas. And the thing is, the states need to step up to the plate and work with these organizations like whoever, whatever they call JD Vance's group, the fraud group. Work with those people to find this fraud because it's billions of dollars of taxpayer dollars going to pay for lavish lifestyles of people and not to provide the care that's needed.
Mm.
So,
Um,
so and the next thing you should do is ask them what is their California hospice license number.
hmm Okay.
Then ask if they're Medicare certified.
hmm
And here's a good one. Who owns the company? Ask, is it for profit? Is it not for profit? You'd
Oh,
be surprised at how many companies are owned by real estate companies. It's so weird. Yeah, yeah. But and if it's for profit, eh, you know what? I believe in capitalism. I believe, but all the not-for-profits have left hospice because of the reimbursement rate in the beginning, and there we used to have volunteers. It was a beautiful system. Now it's there's a lot of sinister bad actors that we have to ask for. So you do want to know who owns the company,
hmm
and and it's frustrating because you don't have time for this all the time, but and you definitely want to know who their medical director is.
hmm
And I personally would call the licensing board or look it up on your state licensing board to make sure he or she hasn't had any complaints against them. And if they have, because they'll tell you if they've had complaints or if they've had any lawsuits filed against them. There's a lot of things you can learn. But
Wow.
I would also ask who is the RN care manager or case manager. There always should be a nurse that's overseeing each case.
Okay. Does that mean that nurse comes out to the home, or does that mean?
Yes, yes.
Okay.
The nurse should be the very first person who goes out to the home to do, or comes to the hospital, or to the assisted living, or wherever you are, where you're going to
Mhm.
have hospice. They need to go out and do an evaluation. They need to do an assessment. They need to figure out what your needs are, what the family needs are. They need to see the home environment to make sure it's safe, that it's clean. There's a lot of things going on, and to know just exactly what the needs of this specific case are going to be.
Okay. Wow, that's good information.
Yeah. And
Woo.
another
Jesus.
thing, you also want to ask, who do we call if care is not provided? You also want to know what are your after hour calls? You know, if I have a question in the middle of the night or I
Mm.
have an issue, what is the expectation for a return call
Uh-huh.
for
Wow.
after hours?
Okay. That's interesting to know, Diane. So basically, there's a list, literally,
Yes,
of
yeah,
questions you need to ask just
yes,
off the top. So being able to
yeah,
give someone that list to so, hey, if you're going, someone's been their loved one's been told they need to go on hospice or what have you. Here's a list of things to look for, and that's
yeah,
tough. And
yeah,
going back to what you said, like people can reach out to you to they can hire you or have you to do those things for them, because it's a lot when a family is trying to navigate, figure these things out. You have so much on your mind, and surely not asking these hundreds of questions is one
Yes, yes,
of those,
yeah.
unless you have another family member who's willing to take on that responsibility.
Our government policymakers have made it such that the family caregiver is carrying the burden of providing care once provided by healthcare professionals. And the burden is too great. It's not meant to be done alone. And but that's what's being forced on the family caregiver. So and they're exhausted, and it's just not fair.
Hmm. Wow. Wow. Well, you know what, Diane? I have some, I don't know if we went over this on the last one, but we wanted to read some data talking about, well, you did, I think,
Yes.
in 2024, you said 9% of patients discharged alive
Uh-huh.
from hospice were later hospitalized and readmitted to hospice.
Yes, yes. And one of the red flags that came up
Mhm.
in that made
Mhm.
Dr. Oz and them aware that there was total fraud going on is in California, 56% of the patients were discharged on hospice. They I, they literally people were cured and they and they moved him off of hospice. I mean,
Repeat that,
I'm sorry.
Diane. Wait a minute, hold on. Repeat that.
Yeah, 56% of the hospice patients, yeah, were with the fraud that was going on, they were
Uh-huh.
noticing that more patients were discharged live versus dead in the California area.
Is that because they started to hear the investigation was taking place? Is that what?
Yeah, yeah, I think so.
Oh, so it's like, okay,
Yeah,
well, they're starting to look into things, so let's get these people
yep,
off real quick.
yep, 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 yep.
God.
It's like, oh Lord, have mercy. But the hospice is to support you through to your last breath, and it's a beautiful service when you have it. And it's very humbling to take care of somebody at the end of their life. I just it takes a very special person to do that. I think we're finally going to be, as a culture, accepting of death and dying in the home because it's going to be occurring at record levels we haven't seen before. And I think that people will, the family members, I hope, again, we have death doulas, we have end of life specialists, we have people that for private pay will come in and support you in ways that hospice should have supported you in the
Mhm.
past, but because the reimbursement has been able to, is so low and it's just not, we're not just going to have that kind of coverage anymore. So if you want a beautiful experience, I suggest investigating and looking for a death doula or an end of life care specialist
Okay.
to talk you through what's going on. And they can be there
Hmm.
to sit with you as you go through the death and dying process with because hospice nurses may not show up until after a person has passed.
So then that will be a question that a family need to ask them, like what happens, or will you be there at that time?
Yeah.
Right? Like, so, or
Well,
do
some of the biggest red flags are they're pressuring you to sign quickly. They they're vague. They have very vague explanations, like you were saying, promises of great benefits or free help, and they don't explain hospice. They provide little to no care.
Mhm.
There's missed visits, poor equipment, you have the inability to reach staff, you should be able to make a phone call and talk to a person or expect a return phone call, like on weekends or in nights. There's somebody on call that should be able to take your call or return your call in a reasonable amount of time.
Of course, then those are questions that you have to definitely ask before you sign on
Yes.
with
Yeah.
one. And Diane, go into let's tell the audience what is a doula? What do they do specifically?
What, say that
The
again?
doula, you because you mentioned the doula before. The Diane,
Oh, the death
yeah,
doula?
the death doula.
Oh,
What
that
is what is that exactly? What do they do?
a death doula is you have you know what a birth doula is, they
Yes.
help you birth your babies.
Uh-huh.
Well, a doula absolutely helps you through the end of life. They help you do your planning of your life. They help you talk about end of life. And there are ones that they will help you do life celebrations or plan your funeral. They will help you get your end of life, your obituary written and plan everything. But they are also there to answer questions and help the family understand the death and dying process.
Wow.
And a good death, oh, I'll tell you what, it used to be done by nurses, but I just did a podcast this last week with
Mhm.
a Canadian who is a nurse, an RN, who is
Uh-huh.
also a death doula. So
Oh,
she's
wow.
really got because the nurses they do like they want to turn and suction and whatever, and a death doula will like talk you through what is happening and what the expectations are. They can explain the active end of life processing, like why are you drooling and not able to swallow? Why it's okay to stop feeding somebody. They'll teach you about comfort measures like maybe
Mhm.
lemon glycerin swabs to clean out the mouth to make you feel comfortable, or put that chapstick or whatever on your lips. They will talk through it. They can help you help explain what's going on as your loved one's dying.
So they do that before. I mean, is that like a certain time period that you would need? And I'm sure the
Actually,
insurance
they
has to
would
pay for that,
come and
right?
oh yeah, it's all private pay, but I will
Okay.
tell you, if you are a family that is has no experience and are fearful of
Mhm.
how things can ha happen during end of life, and like I said before, there are many people that will be confused, and there's terminal agitation and they're arguing and fighting, and then there's people that go peacefully, and like I talked about the chain stoking where
Yeah.
the breathing is rapid and short and then it stops, and you think, oh my gosh, they're gone, and they take another deep breath and they start the cycle all over again. And there's a whole process that we go through, and a death doula will actually, it's going to be, it's a growing field because we absolutely need them with the changes. Everything that you want with medical care is going to be, if you want what's recommended,
Hmm.
you want quality, you're going to have to pay out of pocket for it.
So the reason why I was asking because I mean I've heard of the doulas for birthing and it seems
Mhm.
like that's a growing thing too because back in the day you really never heard midwives and things like that you never
Yeah.
really heard of the birth doulas. Now there's this big
Uh-huh.
thing about doulas for birth,
Yeah.
but now you're talking about one for death, and I have to be honest, I've never heard of one death doula. And
Uh-huh.
I think that's really interesting. So how does people become a death doula? And do you have to be a registered nurse to be the doula? And then how
No.
does families know that you're getting a good doula? How does all that work?
Well, again, there's certifications for a
Okay.
doula.
Okay.
And I will tell you right now that you can it's a personal thing. It's a personality
Okay.
thing. But there are death doulas that do death cafes. I've been to some death cafes when I was in New York, where
Oh,
people come to a library or like a coffee shop and or a restaurant. They get in the back room, and if you have questions about death and dying and you're curious, this is a place to go where you ask people that are familiar with the death and dying process and talk about death and dying and take the mystery out of it. They demystify it. There also is I love this, it's a deck of cards called the Death Deck. And it's a game you play. And I know people are going, oh no, oh no. But you know what? It helps you ask questions you didn't even know you should be asking. And it's a card game, and it will ask a question, and then it's a way to encourage conversation on a very challenging and difficult topic.
It is definitely a difficult topic because
Yeah.
people don't, that's not something people really want to talk about. And it is
It
difficult
needs to
to talk
be
about.
talked about because
Mhm.
it's as common as birth to die. I don't have a fear of death. I have a fear of taking too long and not liking the way I'm dying. But as far as that I'm not afraid of death. I've been at the bedside of many, and it's very it's I to me it's just a sacred experience. It's just to be there. It's very humbling. And I think, and the thing with the death doula, especially, I think with people that are childless couples or solo agers,
Mhm.
to have a death doula that will help support them through their transitioning period is comforting for many of them to know that they won't die alone.
Wow. That's really deep.
Mm.
It's really deep. Wow. Oof. Yeah. Yeah, that is yeah. I remember being by my grandmother, and it was just it was yeah, it's wow. Because you never forget that those moments, right?
No,
And I mean,
no,
like she was in
no.
the hospital, and it's like and the whole family was inside. I'll never forget it. It was like just yesterday. And every time she would, I think she was probably trying to, go to glory.
Yeah,
The thing would, beep or whatever, and everybody just starts screaming and
yeah,
crying.
yeah.
And she would the machine would she would come back, right?
Hmm.
And she
Yep,
did that a few times, and the nurse came in and she says, "Who's responsible here? Like who's in charge to make decisions?"
yep, yep.
And it was my mom and then my sister, but they were like totally out of it. Like they could not make any decisions. And so I walked out and I said, "Well, what's going on?" Like, and he was like, "Well, we can give her," they was giving her dopamine at the time, like, like, and then I was like, "Okay, well, what do we need? Just wait, we can, give her compressions, all that stuff," but we didn't want to do that because she was fragile, right? But just the fact of her every time, and the nurse told me, she says, she's trying to go. I'll
Yeah,
never
yeah.
forget that. She told me that in the hallway. She says, but every time she does, the she could hear you guys.
Yep.
And every
Yep, that's
time,
true.
yeah, and every time she comes back because she's she don't, obviously the
She's
knowing
torn between two worlds. I know people don't believe that or understand
crazy.
that, but I
Yeah,
can tell you I've had this experience too many times that, they're still trying to hang on to our world before
yeah,
they transition. And
yeah,
one of the things that can prevent any confusion at all with family members is to make your wishes known early and talk about it often. Casey, my son knows, I do not want any kind, I don't want IVs, I don't want any, all I want is comfort measures. Do not try to resuscitate me. Do not do anything. And I don't want anything. And, it's just, and I'm very open about it because I don't want my end of life to be somebody pounding my chest and people
yeah.
poking and prodding me and having bright lights all over me because I'm in a hospital being beaten up. Um, I know what I want. I know how I want it. And You have to not only talk about it and have this conversation, you need to have people that will honor those wishes and you put it in writing.
Yeah. Yeah, it's
And
definitely
that's
tough.
why I recommend that if you are, um, we had a conversation about, I said, if a person is not on hospice and they die at home, there could be an investigation as to seeing if there's something sinister happening. And one of the things I want people to know is you can take steps to protect yourself if you're unsure about hospice. So, I mean, that's something we'll talk about later too, but I want to discuss the red flags that we're seeing so that families are sure that they're getting a real hospice
Hmm.
company that's licensed and is going to provide a quality level of service that is needed.
Yeah. Yeah, because that's why we're having this conversation, just so families can know and just be,
Yes.
just know
Yeah.
what to ask, what to look for. And there are some great, amazing hospice companies out there. I've heard families tell me like, "Oh my God, Tara, the hospice company we dealt with was so awesome." You've heard the good and the bad.
Well, I know that when the hospice that I worked for, when a patient died, we went to their funeral.
Yeah,
We actually, because you get attached to
you
people and
do.
you get
You
attached to their
do.
family members, and you're helping them at one of the most vulnerable emotional times in their life.
Mm,
The family members are grieving their loved one, and it is painful, but
yeah,
it is also a life experience, and it means so much to families. So there are such truly good hospices out there, and that is something that is you can have a really good experience if you've got a good hospice. And you may have a licensed hospice company that comes in and it's just not working for you. There's a disconnect.
yeah.
You have a right to ask cancel them and get another hospice in. You just say I'm not working with you. I'm going to work with another hospice company, and that's okay to do too, because it could be a difference in personalities. It
I
could
was gonna
be
say that. Yeah, I was gonna say, not trying to cut you off, Diane, but I was gonna say that, like, you know how sometimes, like, you have a company and
Mhm.
the company is the company, but
Yes,
it's the people that work
yes,
inside of the company. Because as you
yes,
just said, it could be a very good company, and the reviews for the company has been good. Because my thing is, you can't teach people to care.
exactly,
And
exactly.
so if you get someone, now what do you say about you get someone comes in, it's a company, but the personnel, that staff that's there, it maybe not what you feel.
Well, that
Maybe
was
you ask
my
for
issue.
another one, right? Another
Yeah.
somebody else to come in, not changing the company, but maybe a different staff member or what have you.
Well, most of the times it's either the aides were awful
Hmm.
or the nurse care manager was aloof or didn't seem caring enough, and there was nobody else available.
Mm, okay.
And so I agree. I would like to give the company the opportunity to provide another person.
Okay.
But again, they may only have one or two nurses in there. And the way the field is set up, that
Hmm.
nurse has this area,
Oh,
and they may not be flexible in providing another person for you. So those are issues that cause that it can be a good, reputable company, but personality clashes or
yeah.
family expectations are way beyond um, what they expect and what in reality they're getting.
Yeah.
And because I know people are shocked, like, what do you mean I'm going to have to? provide this care by myself. What do you mean? You're coming and going. You're not going to stay with me and talk to me and help me through this. And it's a shock. It's a shock.
I think so, and it is a shock because you even have like caregivers where they go into places. I know, like IHSS, I've heard of caregivers going in, and some families think that the caregiver is supposed to do all of these different things, and they're
Yes.
shocked when they find
Yeah.
out, like, no, they don't. They don't clean your shade. They don't clean
Yeah.
the
Yeah.
curtains.
Yeah. Yeah.
you
Yeah.
know,
Yeah.
and all these things that, people really get shocked when they find out, like,
Yeah.
no, they don't do all those things. They don't get underneath and clean underneath your
Yeah,
sofa.
exactly, exactly. And it's very troubling to many families because
Mhm.
they what they expect and what's provided is two different things.
Yeah.
And it's just families need to have some more realistic expectations.
Right. And that's why it's good that you interview the companies and have that list
Yeah.
ready. As
Yes.
difficult as it may be, have
Yeah.
that list ready to ask those questions so that you can get those answers, and then you can compare the two
Yeah.
or three that you're interviewing. I think that's a good thing to do.
Yeah.
You know.
And again, you have to take the steps to call your Department of Public Health.
Mhm.
And like you here in California, you have the what is it, Cal Find? Is that
Yeah,
what it's
Cal
called?
Fine. It was, yeah, it's
Cal
called
Find.
Cal
You
Health
know,
Find. That's what it's
Cal Health thing. Thank you.
called.
You have that as a system
Uh-huh.
that will help you justify
Hmm.
what or verify that it is a legitimate business.
And one of the things, the questions, it says, what is a hospice? Okay, what is this? What if the family is being pressured? We talked about being pressured to sign on paperwork. Why would a hospice company want to pressure a family to sign? And if you do sign, how long should you take? Like, is there a time period that they say, like, hey, you need to let us know by a certain
You
period of
know what?
time? How
You
does all that
need to
work?
take as long as you need to take.
Uh,
This is not just it's a system, a process that you go through. You're hearing for the first time, oh my gosh, my loved one's dying. These are emotional systems, but there's medical and legal decisions that have to be made. Like in assisted living.
mhm.
You absolutely have to have someone on hospice if they're in starting their decline. And because if you don't, again, you're going to have a investigation by the police into was this a legitimate death or whatever. And there are ways that you can work around that. And,
Mhm.
one is making sure that if you don't have somebody on hospice, that you have a doctor that will just absolutely say that this person was ready for death, and it was not anything sinister on the family's part that occurred.
So now you talked about assisted living. So what about in the house? So basically, what you're saying, because you told me that the other day about,
Yep,
yes, I was
yep,
like, what? So basically, if you have a loved one inside of a home and they're on hospice, and you're like, you know what, I don't want this hospice anymore. I'm done. I'll just take care of my loved one myself. And
yes,
you remove your loved one from hospice totally. And
yep.
should you get palliative care, or what do
Well,
you do? Because you're sort of
I
saying,
personally prefer that if you don't want hospice because you're just unsure about the company or you just don't like what's happening, I know that there's things. Palliative care is a good way to go, and I'll tell you why. Palliative care will provide comfort services. They'll treat symptoms. So
Mhm.
if you have a pain, you can be treated for that pain. You're having respiratory issues and you're having lots of secretions. They can provide a medication that will clear you up, or, provide suction so that you can be suctioned. There's things like that. So I think that's what's really important. Because you definitely want that. But
Mhm.
and the thing is with Well, the palliative care is supportive care. Hospice care is specific to end of life. But you need to make sure that you ask the doctor, um, you know, ask your doctor, what if a death occurs
Mhm.
and I'm not on hospice, or
Mhm.
we don't have hospice. I will tell you that California law includes medically unattended deaths among deaths that may require a coroner inquiry.
Oh, wow.
So and the law specifically references whether the person had been attended by a physician or a hospice RN interdisciplinary team within 20 days before the death. And that's why hospice can make death at home process clearer than palliative care alone. But the thing that you can do is contact your primary care physician
Mhm.
and say, or a specialist that you're working with, and say, we're not having hospice in the home. If the death occurs when they are die while they're at home, will you provide a statement that just that says that they were already dying, and this is not this should not doesn't need a coroner
Mhm.
reevaluation.
Wow.
Yeah, there's a lot. I tell you what, you
It
just don't
is.
know. Yeah,
Goodness
yeah,
gracious. I didn't realize it was so much
yeah,
involved.
yeah. Poor families. It's just way too
It's a
much.
lot. It is so,
Yeah.
it's so, and then if you, and if you get someone who really doesn't explain all these processes and all these steps and what is good, which is the palliative versus the hospice and the what to ask for, what you're gonna do, you're gonna come out every day. My pressure to do the paperwork, are you still gonna provide the service? Are you gonna come every day? You're gonna come once a day? You're gonna, what kind of equipment are gonna get? Oh my God. Ah,
It's
think about that.
exhausting, isn't it? Yeah, yeah.
Yes.
It is exhausting.
Oh my goodness.
So,
Can I
and
go
it's
to the
hard.
hospital? Can I not go to the hospital? I can't take my love to the hospital. Oh my God. Okay. They hurt themselves. So I can't. Whoa.
On hospice, you are providing end of life care. The family has a terminal illness. So medications are no longer provided. Any kind of curative care, only comfort measures are provided. You're no longer seeking curative measures, so you don't see a doctor, you don't see your specialists. All of that goes. And what the thing is to have your family members supported as they transition to the next world, and you want it done so that they are comfortable and and die with dignity.
Yeah. Well, so what happens when a person gets taken off a hospice? Do they go back to their regular medications and stuff, or how does that work?
Well, now that depends on the family. That's where
Mhm.
it makes me nuts. All right, you don't meet your certification. I will tell you, depending on the person and their condition and the
Mhm.
family, I have had patients that were taking off hospice, especially the dementia patients. A lot of them don't go back on their meds because I'll tell you right now, a lot of them start having swallowing and feeding issues, and they can't take the medications, and they're not eating as well. That's one thing. You can start losing your appetite and not eating as well for as long as a year before you start, it's part of your decline.
Mhm.
So, you don't have an interest in food like you did. You have issues when you eat and you just don't enjoy it. There's things that happen when you start to have a slow decline.
Wow. Whew. Well, Diane, well, where can people find you, Diane, to get all these things answered? Oh my gosh, the caregiverrelief.com is your podcast. It's an amazing podcast, you guys out there.
Thank
You
you.
guys have got to go and listen in to Diane's podcast. Caregiverrelief.com. I tell you, when I listen to the episodes, I learn something new every single time. And I mean, she has people on it from all over the world, and it's such great information. But Diane, how can people reach you? Just kind of tell them how they can go about reaching you, especially for this situation here. If someone did need to hire or find someone that can help them through this process, knowing what questions to ask, what to do, how to go about making sure they get the right facility or hospice
Well,
company.
I do have a resource section on www.caregiverrelief.com, and there's lots of free resources on what to ask hospice, um, how to do advanced planning, end of life questions, that type of thing. And I even have an elder care communication course where we have sections in it where we address advanced how to talk about death and dying. But anybody can reach out to me anytime at Diane at Diane at caregiverrelief.com. Um, I've been a nurse for a long time. I have no problems. There's not a question that you won't ask me that if I don't have the answer, I have the resources to reach out to somebody to get the answers that you need.
Yeah, and yes, you do. 'Cause you call it Diane, ask her all the other questions. Oh my God, Diane. I had this client and they need so and so, and she's right on it to tell them blah 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 blah. So
I've been
yeah,
very blessed to have an incredible nursing career where I have been exposed to many types of nursing versus traditional nursing versus alternative settings like care management, discharge planning.
yeah,
I even did sales and marketing. So I've done so many different things, and I've also been an advocate for my son who was in the military, that dealing with the military medical delivery system,
mhm.
and that's challenging. I'm a fierce advocate. I help, I'll get you all fired up so that you'll be able to be a fierce advocate too if you listen to me. And you know what?
Yeah,
I just know I've also been a caregiver to my family members, and I
mhm,
know the exhaustion
yeah,
and the physical pain of caregiving. So, and one of the things I was excited to help you with today, Tara, is that having this conversation because people are in trauma right now. They're
yeah,
in need of services and they're confused.
yeah.
And, they can check you out and, or give me a call, whatever they need. But we're providing them with the answers right now, or the resources at least to help them move forward to make
Yeah.
heavy duty decisions.
Yeah, to make things just a little bit easier. I always say that any kind of information that we can share to just make life just a little bit easier,
Yeah.
um, for, just because it's just so, I mean, I see it like from patients and their families, like direct, because, we deal with families every day,
Yeah.
direct
Yeah.
every day. And then when they come to us, they're just sometimes just broken. Or
Oh,
just trying to figure it out.
100%.
Yeah.
And what's sad about this situation with the fraud is that people don't know who to trust. They don't know who to believe, and it's
Yeah.
really sad when you have doctors who have to be involved in this in some way to have the prod. Because they have to have a license to be an agency qualified to be an
Yeah.
agency. So that it's just there's a lot of for me, it's sadness that
Yeah,
we
yeah,
have
it
this
is.
occurred. It really
Yeah,
is. But
yeah.
thank you for having me, and I am looking forward to our next conversation.
Yes. Oh my gosh. Thank you, Diane, for always just, answering my calls, answering the call, and for, families and caregivers. And so, and you guys, this episode today is sponsored by CFS Medical Supplies and Equipment, CFS Solutions. And I always say, stay tuned for the next episode. Oh my God. You guys have heard it here today on the medical equipment world and healthcare. Get the scoop. All right. Thank you, Diane.
Thank